The first topic that we are going to cover in this week's module is stuttering and other disorders of fluency. So, fluency refers to the smooth way in which we speak, and stuttering is the major subcategory of fluency disorders. We are going to begin by going over some general statistics and the textbook definition of stuttering, and then we will move on and discuss some treatment options and some of the theories behind why we stutter or individuals stutter. Stuttering typically begins in early childhood, and it is the most common disorder of fluency. The longer that stuttering persists in an individual, the more likely it is that associated emotional problems will develop. So, as listeners react to a child developing stuttering speech, the child will also react to his or her speech and to the reactions of others. So, the child may feel embarrassed, guilty, frustrated, or angry. And many people who stutter come to feel helpless, which often damages their sense of personal value. Stuttering frequently leads to confusion and to social and emotional conflicts for the child or adult speaker and for his family, friends, teachers, and anyone else who interacts with him. Stuttering affects the fluent, smooth, and effortless flow of words emitted by a speaker, and it's long been recognized as a problem. Although a great deal of research has been conducted on people who stutter, we still do not know its cause. People who stutter present with a wide variety of symptoms, and these symptoms are both visible and invisible. They may repeat sounds or words. They may prevent their vocal folds from vibrating, resulting in a block or an absence of sound, or they may prolong sounds abnormally. In addition, they may show secondary behaviors. These could present as eye blinking, head jerking, or facial grimaces. And many people who stutter show a great deal of muscular tension and forcing when they try to speak. I had a client who was around 30 years old who had a severe stutter, and one of his secondary behaviors was that he would present with so much tension in his lips when he was blocking on a sound, and honestly, it looked painful. That's how tense he became. He confided in me, and this is a very common thing with individuals who stutter, that individuals often substitute words and they talk around what they actually want to say. So while he was speaking, he told me he would know, like there's a word coming up and he knew he was going to block on it. So sometimes he felt like he couldn't even convey the message that he wanted to convey because he was constantly like readjusting what he was going to say in the moment to try to avoid stuttering. Okay, so as I mentioned, stuttering is a major subcategory of fluency disorders. It's present in approximately 1% of the population. As a speech pathologist in the school, depending on what age you work with, you are more than likely going to have some fluency cases on your caseload. Right now, out of 65 kids that are on my caseload, 7 of them have fluency disorders. So it is something that if you go the school-based route, you are going to encounter more than likely. 85% of all cases of stuttering begin at the preschool age, and boys outnumber girls who stutter 4-1. However, there was some research done about different cultural backgrounds and stuttering prevalence. So in African Americans, the ratio changes to 2-1. And this suggests that there is an influence of cultural effects on stuttering. So according to your textbook, stuttering is defined as the disruption in the fluency of verbal expression. It's characterized by involuntary, audible, or silent repetitions or prolongations in the utterance of short elements, namely sound syllables and words of one syllable. These disruptions usually occur frequently or are marked in character and are not readily controllable. Disruptions can be accompanied by accessory activities. I referred to them as secondary behaviors earlier. And these involve the speech apparatus, related or unrelated body structures, or stereotyped speech utterances. This gives the appearance of stuttering being a speech-related struggle. There are indications of the presence of an emotional state ranging from general excitement or tension to more specific emotions such as fear, embarrassment, and irritation with stuttering. In addition to stuttering, there are other disorders that will affect an individual's ability to produce fluent speech. The first one that we are going to speak about is acquired or neurogenic stuttering. So, this is a common problem that usually occurs as a result of a trauma to the brain, such as stroke, auto accident, projectile wound, brain disease, or intake of drugs. And this type of fluency problem is not associated with a past history of stuttering. Psychogenic stuttering is a rare condition that reportedly occurs as the result of an emotionally or psychologically traumatic event. It's a little controversial because there have been many cases of this disorder cited in the literature. However, the authors of our textbook have only witnessed a couple of clients out of over 1,000 who were suspected of stuttering as a result of emotional or psychological trauma. Okay, and finally, the last form of fluency disorder we'll speak about is cluttering. So, this is a less commonly occurring fluency disorder that begins in childhood. I'm going to read the definition to you. It's defined as a disorder of speech and language processing resulting in rapid, dysrhythmic, sporadic, unorganized, and frequently unintelligible speech. Accelerated speech is not always present, but an impairment in formulating language almost always is. In contrast to stuttering, people who clutter are also said to struggle academically, and they are unaware of how unintelligible and abnormal their speech sounds to listeners. Now we're going to talk about some miscellaneous facts related to stuttering. The first one is that stuttering occurs nearly equally between the sexes in early childhood. However, males outnumber females who stutter greatly in adolescence and adult years. Early on in the presentation, I spoke about that discrepancy between males and females who stutter. We're not sure why this is the case, that stuttering persists more frequently in males into adulthood, but researchers have offered several possibilities. So the first is that the inherited genetic predisposition to stutter could perhaps be stronger and more enduring in males. That environmental expectations of males may differ and result in males being more likely to continue stuttering past early childhood. And finally, because males have been shown to exhibit more language and articulation problems compared to females, males might also be more susceptible to stuttering persistence. There is also a higher prevalence of stuttering in twins, and one idea behind why this is the case is that perhaps stuttering in twins could result from a slowness in maturation in early development. So, stuttering doesn't develop in most children as they're learning their first words. Instead, it's often associated with when the child begins to speak in longer phrases or sentences, and this is typically between ages 2 and 5. Empirical evidence is lacking as to why this is the case. However, some researchers suggest that combining words could increase stress to the child's cognitive and motor system, and this could create a breakdown manifested as stuttering behavior. So another possible reason for this could be the child could react negatively to normal mistakes that he's naturally making as his speech and language becomes more complex. And his stress reactions to normal disfluencies could further tense like his speech production mechanism, and this could result in more frustration and tension and subsequent stuttering. Although some cases of adult onset stuttering have been reported, very few persons begin stuttering in adulthood. The majority of them begin stuttering in early childhood. Another fact is that stuttering increases in several situations. So there are several known conditions that are associated with an increase in stuttering. These are speaking on the telephone, speaking to large audiences, and speaking to authority figures. Other situations could possibly be telling jokes, saying one's own name, and speaking in any situation where speaking fluently is considered extremely important to the person who stuttered. These situations also can vary from client to client. So when I'm working with stuttering clients, one of the first things that I like to do is use a rating system and try to identify the situations or people that the individual feels as though they stutter the most with. So I have a friend who stutters, and she says the most she knows for a fact the person she stutters with the most is her mom, because that is the person she is the most comfortable with in the world, and she never feels like she has to worry about being fluent speaking to her mom. She can totally let her guard down and just let all of her disfluencies out. I had a client that I worked with who said that he stuttered the most when he was talking on the phone or speaking with his boss at work. So we can use like our prior knowledge of possible situations that are more like cause more demand and cause someone to stutter more when we're assessing our clients, but it is always good to determine from them exactly what situations they feel like they are the most disfluent in. And I also feel like when you identify these situations, that's always a great place to start to make your goals for treating this individual. So I saw someone in a private clinic and he had trouble speaking on the phone. And that was great because when he and I were just speaking one-on-one, he was totally fluent, totally fine. I was so surprised by the severity of his stuttering when we practiced making a phone call to make a reservation at a restaurant once. So what that did was it provided me the opportunity to help him use fluency enhancing strategies in a high demand kind of situation like that, because that was where he was having like the most breakdown. And it's a way of having like developing much more functional goals for your client that's going to help them be more successful. Okay, and finally, our last stuttering fact is that stuttering is found in children who are bilingual. There's a higher percentage of stuttering noted in bilingual children, and this is believed to result from syntactic overload or the extra linguistic demands experienced by children learning more than one language. Young children who are expected to speak more than one language tend to be at greater risk for stuttering. This could possibly be attributed to the greater demand placed on their motor and cognitive systems. As I'm sure we all already know, learning a language requires an incredibly complex and not fully understood synthesis of motor and cognitive interaction and cooperation. So therefore, learning two languages could possibly place increasingly heavy demands on those syntactic systems of young children. The National Stuttering Association and Stuttering Foundation put out posters that have many famous people who are known stutterers, such as Marilyn Monroe, James Earl Jones, Aristotle, Joseph Biden, George Washington, and Tiger Woods. And I think that showing this to your clients and letting people know that many people have overcome this condition and have been able to use strategies to become more fluent, I think that that can be really motivating for some of your clients. So you might be wondering the ideal reaction to have when someone is stuttering. Sometimes people wonder, what should I say? Should I try to affirm this person by saying, take your time, slow down, take a breath? Or if I know the word that the person is trying to get out and they're stuck on it, should I just say it to them? And the answer to all of these questions is no. Most times individuals who are stuttering are more uncomfortable than you are, and typically like the best reaction to these sorts of situations is to just maintain normal eye contact and just be patient and let the person finish before you respond. So this visual here details the different stuttering behaviors you could see. So on the left we have the core or primary stuttering behaviors, and these are repetitions, prolongations, and silent blocks. So silent blocks sound exactly like their description. It's when an individual just gets stuck in like a pause. So they're like, can't get out what they want to say. Prolongation That's when individuals stretch out like a particular sound in a word. And repetitions, that can be part or whole word repetitions. So they might repeat the initial phoneme, they might repeat whole words. On the right side, you see secondary behaviors. So they're called secondary behaviors because they occur as a result of the core or primary stuttering behaviors. So these include eye aversion, abnormal head or body movements, avoidance, revisions, verbal interjections, and recoils. There are several forms of avoidance that adults and children who stutter tend to employ. The first one that we'll speak about is postponement. So that's a temporal delay used by the person who stutters as they attempt to speak. So this can take the form of vocal behaviors such as saying, let's go out to dinner, or non-vocal behaviors. So the individual could move their head back and forth prior to beginning their sentence. Then the next form of avoidance that we'll speak about are starters. So while postponement is used to try not to stutter, a starter is different because it tries to facilitate release from a stuttering block. So once an individual starts to stutter, they'll use a sudden movement of their body, such as their head or a jaw jerk, to try to get out of that stuttering moment. The next form of avoidance that we'll speak about is substitution. So this behavior is used to avoid or minimize stuttering, and it involves replacing one word with another. This strategy of using a synonym is usually implemented in an attempt to completely avoid any stuttering episodes. And finally, we have circumlocution. So that's another common strategy where the person uses additional words or rearranges word order in an attempt to get around an anticipated or in the moment stuttering event. So if a person wants to say, I want to go shopping with Tanya today, they could try to like dance around that and say something illogical like, today, I and Tanya we went over there at the mall. So these behaviors are ones that individuals who stutter kind of pick up on themselves, but unfortunately, more often than not, these learned attempts to lessen the amount and the severity of stuttering end up doing the opposite. They'll actually increase the stuttering as well as the appearance of abnormality to a listener. So in terms of assessment in individuals who stutter, Charles Van Riper is a very historically famous in our field, researcher of stuttering. He came up with this list of criteria that he believes is indicative of a stuttering problem, and you can see that here. There are also some standard measures that you can use to assess individuals with stuttering. So the most common is the Stuttering Severity Instrument, or the SSI. And what that does is it has age-appropriate either picture description or reading tasks in it. And what you have to do when you're giving that exam is calculate the percent syllable stuttered. So while you're administering it, you have to keep a tally of how many syllables are in the passage in total and keep track of how many the individual presents with disfluencies on. And then it also has a rating scale for the concomitant or secondary features that an individual with stuttering can present with. So that's used as your norm reference tool generally when you're diagnosing individuals with stuttering. So there's also some common questions that clinicians ask the families of individuals who stutter. So these could be, in your own words, tell me why you're here today. What aspect of your son's speech concerns you the most? When did you first notice that he's stuttering? What did you hear that made you realize that it was stuttering? How did he then and how does he now react to his stuttering? How do you and your other family members react? And do any other family members stutter? And these questions can also be adapted to ask older individuals who stutter if you're not getting the case history or background information from a parent. You could just ask the individual these questions directly. Some other good questions to help you get a baseline measurement of your client would be to ask, what behaviors do you call stuttering? Why do you think that you stutter? In what situations do you have the most difficulty with stuttering? And one thing that I want you guys to keep in mind when you're developing your treatment plan is that, especially for your older clients, their secondary symptoms of stuttering are going to definitely need to be addressed, and you're often going to want to assess their emotional and cognitive aspects of stuttering. There is a tremendous counseling piece that goes into helping individuals who stutter. Finally, I want us to speak about treatment of fluency disorders. So there are several different kinds of approaches to treatment. The first one we're going to discuss is fluency shaping. So in a fluency shaping treatment approach, that involves decreasing the occurrence of stuttered speech. So the goal is for the client to learn to speak more fluently. And one way to accomplish this goal is to structure treatment so that the client produces short utterances that are free of stuttering, typically at the syllable or one-word level at first. One fluency shaping thing that you guys might have heard of is using easy onsets or using a slow rate of speech. Now, fluency shaping is an evidence-based approach that has proven to be successful. However, I have heard many adult clients report that using these fluency shaping approaches can be exhausting in conversation. They have to pay attention so much to using these strategies to try to eliminate their stuttering. And sometimes it's just, they feel like it's not even worth it. That's not to say that's everybody, but I have heard clients tell me that. So that brings us to our next approach, which is stuttering modification therapy. And in this approach to treatment, the client just learns to stutter in an easier and more controlled manner. An example of a technique that follows the stuttering modification approach is the technique of pullouts, which is when an individual holds on to a moment of disfluency long enough to gain control and then move forward with their speech. Another stuttering modification approach that I have heard people have great success with is called voluntary stuttering. So what individuals with this do is when they're having a conversation and they feel like they're going to be disfluent, say they're giving a presentation, when they first started out, they're going to stutter on purpose a few times. And the rationale behind that, I think this approach is so interesting. The rationale is once they get a few disfluencies out of the way and their listeners are expecting them to stutter, it makes the situation less difficult for them and they're able to just be more fluent in the conversation. Personally, out of all of the clients I've ever worked with, I found voluntary stuttering to be the approach that I had the most success with individuals. I've heard other people that I didn't work with say that that worked the best for them, which was what made me research it more to work with my older clients. And I just feel like if that's something that you guys are interested in, I really suggest you read up on it. I think it's fascinating. So I don't want you guys to think that if you choose to use a fluency shaping therapy approach with your client, that you can't try a stuttering modification therapy approach. And that brings us to our next approach, which is the integration of fluency shaping and stuttering modification therapies. So maybe there are some techniques from the fluency shaping approach, like easy onsets, that you feel your client has had great success with, but you want them to try working on pullouts. And that's from the stuttering modification therapy approach. That's totally okay to do. As clinicians, we should be adaptable and you should try to vary your approach and see what fits each of your individual clients best. There are also some electronic devices that have helped enhance individuals' fluency. An example of this is the Speech Easy device, which is a small device that resembles a hearing aid, and it delivers delayed auditory feedback. And this causes wearers to essentially hear their voice echoed back to them at an altered pitch. And it has been shown to be effective in everyday life for some people who stutter. One of the problems with this is there's no reliable method to determine who exactly might benefit from the Speech Easy. What we do know is some people who stutter find these devices to be more helpful than others. And it should be considered a viable treatment option for individuals who have stuttered for a significant period of time and continue to struggle with the disorder, individuals who have a history of unsuccessful stuttering treatment, individuals who have busy schedules that don't allow them to go to traditional speech therapy, or individuals that live in rural areas where gaining access to a speech language pathologist is difficult or impossible. And the last intervention approach we're going to speak about is parent-directed intervention. And this typically is most effective with your younger clients. And as implied by the name, this approach involves the parents providing treatment to their child once they have been trained how to do so by a speech language pathologist. The most famous and well-known example of this is the Lidcombe program. This is an individualized behavioral approach to stuttering, and it can be used in children 6 years of age or younger. And the parents do the treatment, not speech language pathologists. The goal of this program is to completely rid the child of stuttering. To some people, this goal might sound exaggerated and unrealistic. However, as with many other intervention programs focusing only on very young stuttering, it's not unrealistic to expect this outcome for many.